Today we're going to talk about phobias. A phobia is an extreme or irrational fear of something. They develop when a person has an exaggerated or unrealistic sense of danger about a situation or an object. Phobias can cause a lot of distress. It may restrict your day-to-day life. If phobia becomes very severe, a person may organize their life in avoiding the thing that causes them anxiety. A phobia is a type of anxiety disorder. You may not experience any symptoms unless you come in contact with what you are scared of. But in some cases, even thinking about the source of your phobia can make you feel anxious, and this is known as anticipatory anxiety. Symptoms may include unsteadiness, dizziness, and lightheadedness, nausea, sweating, increased heart rate or palpitations, shortness of breath, trembling or shaking, and upset stomach. If you do not come in contact with your source of phobia, you can live your normal life. But if you have a complex phobia, such as agoraphobia, it's hard to live your normal daily life. There are two types of phobias, specific or simple phobias and complex phobias. There are a wide variety of objects or situations that someone may develop a phobia from. Simple phobias center around a particular object, normal situation, or activity. They often develop during childhood or adolescence, but they become less severe as you get older. Common examples of simple phobias include animal phobias such as dogs, spiders, snakes, or rodents. More scientific names for these are cynophobia for dogs, arachnophobia refers to the intense fear of spiders, ophidophobia for snakes, musophobia for rodents, which are mice and rats. Environmental phobias such as heights or acrophobia, deep water or thalassophobia, and germs or germophobia. Situational phobias such as going to the dentist or dentophobia, flying or aerophobia. Bodily phobias such as the fear of blood or hemophobia, vomit or emetophobia, or the fear of having injections or trypanophobia. And sexual phobias such as performance anxiety or the fear of getting a sexual transmitted infection or cypridophobia. Complex phobias are more disabling than simple phobias. They develop during adulthood and is associated with a deep-rooted fear or anxiety about a particular situation. There are two main types of complex phobias, which are agoraphobia and social phobia. Agoraphobia is an extreme or irrational fear of entering open or crowded places, of leaving one's home, or of being in a place or situation where escape is difficult or help might not be there. The anxiety usually results in the person avoiding situations such as being alone, being in crowded places such as busy restaurants or supermarkets, traveling in public transports. Social phobia is a mental health condition. It is intense fear of being watched and judged negatively by others. This fear can affect work, school, and your other day-to-day activities. It can even make it hard to keep and make friends. If you have social phobia, you might be afraid of speaking in front of others for the fear of embarrassment and being humiliated by others. There are multiple causes of phobias and many associations. For example, a phobia may be associated with a particular incident or trauma. For example, you get air pitfalls while you are flying through an airplane. It happened to me once, and I thought that we are about to fall down while it was just some pitfalls. A phobia may be a learned response that a person develops early in life from a parent or sibling. Also, genetics may play a role. Some people are born with a tendency to be more anxious than others. Phobias are not usually diagnosed. Some people want to avoid the thing that they are scared of, but this makes the phobia even worse. Ask a general practitioner for help if you have a phobia. They may refer you to a specialist with expertise in behavioral therapy, such as psychologists. Almost all phobias can be successfully treated and cured. Simple phobias can be treated due to the gradual exposure of the source of your phobia. This is known as desensitization or self-exposure therapy. You could try this method with the help of a professional or as part of a self-help program. Treating complex phobias usually takes time and involves taking therapies such as counseling, psychotherapy, cognitive behavioral therapy. Medication could also be used to help people cope with the effects of anxiety. Medications include antidepressants, tranquilizers, and beta blockers. Phobias are the most common type of anxiety disorder. They can affect anyone regardless of age, sex, and social background. Some of the most common phobias include arachnophobia, the fear of spiders; claustrophobia, which is the fear of confined spaces; agoraphobia, which is the fear of open space and public places; social phobia, which is the fear of social situations. All phobias can limit your daily activities and may cause severe anxiety and depression. Complex phobias such as agoraphobia and social phobia are more likely to cause these symptoms. People with phobias will not get in contact with the thing that they are scared of. For example, someone has the fear of spiders or arachnophobia will not touch a spider or even look at a picture of one, which is not a good thing to do because one of the treatments are the gradual exposure of the source of phobia. In some cases, a person may develop a phobia where they become fearful or experience anxiety itself because it feels so uncomfortable. Sometimes you don't have to be in the situation you're fearful of to experience the symptoms of panic. The brain is able to create a reaction to fearsome situations even when you aren't actually in the situation. People with phobias often have panic attacks. The symptoms often occur suddenly and without warning. A panic attack can cause uh, physical symptoms such as sweating, trembling, hot flushed, or chills, shortness of breath or difficulty breathing, a choking sensation, a rapid heartbeat or tachycardia, pain or tightness in the chest, a sensation of butterflies in the stomach, nausea, headaches, and dizziness, feeling faint, numbness or pins and needles, dry mouth, I need to go to the toilet, ringing in your eyes, confusion or disorientation. In severe cases, you may experience psychological symptoms such as fear of losing control, fear of fainting, feeling of dread, and fear of dying. Alhamdulillah.
Okay. So thank you, Rayan. So we could say that anxiety, the lesson that the anxiety disorder that we took yesterday, and phobias are in the same page, basically. Um, a phobia can result in you getting anxiety disorder, so it's really important. But one thing I want to point out is that um, phobias is not the same thing as normal day-to-day fears and anxious moments. Like for an example, let's say somebody has fear of heights, for an example. Um, well, obviously, if, for example, if somebody is sitting 3,000 meters in the under a glass floor, he will definitely be scared. No matter, I mean, looking down a glass floor from 3,000 feet, it's scary for anyone. Um, but the difference is somebody will may somebody may take the risk of going 3,000 meters in the air. A person with phobias will never get near that place. He can't. Like there's a difference between the normal and phobias, normal fear and phobias. It's a different scale, let's say. So complex phobias such as agoraphobia and social phobia can often have a detrimental effect on a person's everyday life. So when they say complex phobias, these are like social phobias and agoraphobia. These phobias affect a person's day-to-day life because they can't do what, like for example, they need groceries. Sometimes he can't go to groceries because he's afraid that the marketplace will be crowded. Um, Agoraphobia often involves a combination of several interlinked phobias. So, for an example, someone with the fear of going outside or leaving their home. He doesn't want to be in public. He's afraid that people will see him. He doesn't want to be in public. May also have the fear of being alone. They're interconnected, interlinked sometimes. Honestly, I don't know why, but yeah. Um, or people with agoraphobia can also have claustrophobia. Symptoms experienced by people with agoraphobia can vary from severity. Um, for an example, some what's an example? Okay, some people can feel very apprehensive and anxious if they leave their home to go to the shops. Although others may relatively be comfortable traveling short distances from their home. Okay, some people might have social phobia that they won't even go out of their homes. Some people have social phobia that they can just go to the shop or the baqqala near their house. It's okay. Next slide. If you have a social phobia, the thought of being seen in public or at social events can make you feel frightened, anxious, and vulnerable. Somebody with social phobia might always look at himself, make sure that he looks good, always aware of who's around him. He can't function properly outside. He's just always anxious and nervous of what people will look at him. And the cause of this may be because of his childhood. Like maybe he went in an elementary school that always judged him. Oh, you look like this. Why is your hair like this? Why do you wear so much colored T-shirts? So every time, so if he gets traumatized at a young age, he will be afraid to go in public because he might be afraid people may judge him. Um, and unintentionally avoiding meeting people in social situations is a sign of social phobia. In extreme cases of social phobia, as with agoraphobia, some people are too afraid to leave their home. Yeah. Several treatments of phobias are available, including taking therapies and self-help techniques. However, it can often take some time to overcome a complex phobia. Hopefully everything's clear. All right, next slide. What can cause this? As I said before, uh, causes of phobias can include childhood experiences. It usually develops during childhood, adolescence, or early adulthood. So when they're young, they get traumatized. They're often linked to a frightening event or sexual situation. However, it's not always clear why some phobias occur. Again, with the same concept applies to almost every disease. The cause is not 100% sure. You can't be 100% sure of a cause, but you can make predictions. And and like yeah, specific or simple phobias such as fear of heights usually develop during childhood. If let's say if a child um
Hello.
hello.
I'm sorry to interrupt, but I'm having an internet issue today. The Wi-Fi goes off for about 15 to 30 minutes, then it comes back. So
It's
that's
okay.
why I'm
It's
back. I'm
okay.
sorry.
It's okay. Simple phobias can often be linked to early negative childhood experience. For example, if you travel in a confined space when you're young, you may develop a fear of closed spaces. If you see a person fall as a child from a cliff and he gets severely injured, you might develop the fear of because you're too afraid that that may happen to you. And mentally, each time you are near that situation, your brain warns you. You've seen this before. Don't do it again. Uh, the same applies with almost any phobia that there is. Uh, let's say paper. Maybe a person saw a relative of his gets a very harsh paper cut that's opened until his bone. I know that's not even possible, let's say, um, his brain tell him to that this situation happened before, be aware of it, and then you get anxious every time you see a piece of paper. It's also thought that phobias can sometimes be learned from an early age. For example, if someone in your family has a fear of spiders, you may also develop the fear of spiders. Okay, that makes sense. I mean, if people are always warning you about something, you can become so scared of it that your brain tells you people are always warning you of this. Don't get near it. Other factors in the family environment, such as having parents who are particularly anxious, may affect the way you deal with anxiety in their life. Basically the same thing as I said before. If your parents are always worried about something, you may also develop that worry that they have. Next slide. Causes for complex phobias. Um, it's not known why this happens. However, it's thought that its genetic, brain chemistry, and life experiences may all play a part in these types of phobias. The physical reactions a person experiences when faced with the objects of their fear are real and aren't simply in their head. So it's not that the symptoms.
I'm sorry
Okay,
to interrupt again, but I got disconnected. I'm back.
all right, no problem. The body reacts to threats by releasing the hormone adrenaline, which causes symptoms such as sweating, trembling, shortness of breath, and rapid heartbeat. I'm pretty sure all of you guys know what adrenaline is. Just for an example, let's say in real life, if you see a person with a gun, um, your brain is going to release the hormone adrenaline to make your muscles work, your specific muscles work. That will, yeah, you have more energy because of this, because your brain is saying, "Oh, this is dangerous, a dangerous place. You need to go." So yeah, symptoms of adrenaline release is sweating, trembling, shortness of breath, and rapid heartbeat. Just get nervous, basically. All right, next slide. Any questions so far? We're good. Okay.
Adrenaline is not
Okay.
always a negative thing. It also comes out when you
Yeah,
get
it's not
excited.
always a negative thing. Yup.
Yeah, you
And like fears are not always negative. Yeah,
you get
adrenaline.
it off
It
as if
happens
it's a
when
bad
there's
thing.
a scary moment. I mean, running away from a robber is not a bad thing. Anyways, yeah. I mean, I want to talk about this more. Thank you, Ali, for bringing this up. Having a fear of something is not always typically bad. But what we're specifically talking about when we say phobias is like you're so traumatized that this fear is sometimes not in its place. Having the fear of a lion, for an example, is not bad. It's okay to have fear of a lion because he might eat you. But an unreasonable fear that may affect your life, such as social phobia, for example, can affect a person's life negatively. So yeah, very nice point, Ali. Thank you so much. All right. Um, this is next slide. Yeah. How do you treat a person with an exaggerated fear or a phobia? Usually, these people with phobias don't need treatment. They just need to. They can avoid the object of their fear, but sometimes they can't avoid this fear because it's an everyday life, like social phobia. Especially with complex phobias, you can't really avoid it because you need it for your everyday life. So it's better to find the only way to cure a complex phobia is by through treatment. Um, Treatments include self-help techniques, taking treatments, and medication. So yeah, summarize what I just said. I said a lot of words there. Um, a normal phobia such as like fear of tigers or something like that, it can be avoided, and there's not no really need to stress about it or take any medications or treatment about it. But a fear of social phobias, for example, you need to seek help because, well, it's unavoidable. So uh, you need to seek mental medication attention. Right. Next slide. Um, a specific type of treatment is counseling, otherwise known as CBT, cognitive behavioral therapy, and mindfulness have been found to be very effective in treating phobias. Basically, mental therapy sessions. Any questions so far? Or am I saying too much and like confusing everything?
No, it's fair.
I think we're good. All right. Cognitive behavioral therapy, CBT. CBT is a type of counseling that helps you manage your problems by changing the ways you think and behave. It can be used to develop practical ways of dealing with your phobias. So yeah, basically an experienced, let's say an expert, um, about the specific fear you have will just counsel you, talk to you about this thing, and they have special ways of talking about it that may change your mindset towards this thing. One part of CBT treatment process that often used to treat simple phobias involve gradual exposure to your fear, so you feel less anxious about this. This is known as desensitization. We talked about this yesterday. Um, when you have a exaggerated fear, a good idea would be to go and experience this thing that you're really scared of. Um, there's an old saying, face your fears. Don't let them like overpower you. So mentally, what happens is, oh, you go and experience this thing, and then your mind says, oh, this is not so scary. I don't know why I was scared of this all the time. Like an example for a spider, let's say. A person is afraid of spiders. He can't even look at a picture of a spider. So what they'll do is they'll have a trained spider, for an example, and they just put it on him, and they have him sit there for a while until his body realizes, oh, the spider is not that dangerous. Why was I afraid of this? And they keep on going. Uh, okay, that's another example. The fear of snakes. If you have a fear of snake, uh, your therapist might make you read about snakes. Oh yeah, maybe sometimes you don't need to go too far with this because it may cause an even greater fear. Like maybe his body will react really quickly and possibly have a severe panic attack, or possibly get uh, get knocked out. Um, Exposure therapy works by gradually increasing the level of exposure of your fear, which allows you to gain control over your phobia. As the treatment progresses, you should begin to feel less anxious about your phobia. Cool. I like desensitization. Next slide. Medication is not recommended because it may have side effects, and if you can have um, of like not physical, mental therapy, it's way better than taking medication. However, it's sometimes prescribed on a short-term basis. Maybe you faced your phobias and now you're spending all day thinking about this phobia and having a panic attack. Let's say you're afraid of heights, and without you knowing, somebody took you on an elevator to a let's say 30th floor, and you didn't even know it, and then and then when you realized it, you got a panic attack, and that attack stuck for you for 3 days. They might give you medication um, to hopefully um, just calm you down. Medication may include antidepressants, tranquilizers, basically knock you out, and beta blockers. Good. Okay. Tranquilizer. There's benzodiazepines. I don't know. I'm bad with words. Are a group of medications that are categorized as minor tranquilizers. They include medicines such as, I'm not going to say it, and are sometimes used on a short-term basis at the lowest possible dose to treat severe anxiety. So if it's very severe, they might use tranquilizers. You might heard of it before. Um, but they will use minor tranquilizers to not knock you out, to just basically make you unconscious. Um, like antidepressant, benzodiazepines
Ben
should be stopped.
Dova.
I'm bad with names. I'm sorry. It seems unprofessional, but I'm really bad with names. Um, should be stopped gradually to avoid withdrawal of symptoms. All right, next slide. Beta blockers. Beta blockers are often used to treat cardiovascular conditions such as heart problems with high blood pressure. Oh, I like this. Um, it's relating how a sudden panic attack can possibly increase your can increase your blood pressure and your heart or heart problem. So there's a good relationship that we can see there. We are sometimes reduce symptoms of anxiety such as palpitation, irregular heartbeats. Okay, so yeah, when you get a sudden panic attack of a phobia, your body releases the adrenaline that we talked about, and this increases your heartbeat because you want to get out of the situation fast, and your heart works extra fast to send out all the blood that a particular part of the body needs. And as we took from the last unit, an irregular um, high blood pressure, hypertension, can cause all types of blood problems. This is acute high blood pressure, but it's still the same thing. So they don't want your high blood pressure to explode, so they use beta blockers to slow down your heart rate, slow down the blood pressure, and make everything nice. Propranolol is a beta blocker that commonly used to treat anxiety. Possible side effects include stomach problems, cold fingers, tiredness, and sleep problems. Again, medication is not always the best solution, because it might have side effects, and if you can orally um, avoid avoid it, it would be really nice. Next slide. Self-help is a type of treatment that you can use. Each phobia is different, and no single self-help problem will work for everyone. So your phobia is different. A person's phobia is different from another person, so treatments might differ from person to person. You may decide to use your own self-help strategy to get help from a mental health specialist, such as a psychologist. Um, self-help. So yeah, self-help program may include lifestyle changes, a course of cognitive behavioral therapy, the one that we talk about, which includes these. I don't know how to say it, but when you face your fears, attending a self-help group, using exposure therapy to become all your fear, a combination of these. So these are all types of things that a person can put into considerations to face a certain phobia. Next slide. Lifestyle change. When we say lifestyle changes, we say regular day-to-day routines that can better your mood, and hopefully you're not too scared of what you're scared of. This includes regular exercise, eating healthy, getting enough sleep, reducing or avoiding caffeine and other stimulants. I don't know if I can put this, but Mr. Natapan talked about this in the beginning. Um, Looking at your phone first thing in the morning. Would you say that's a lifestyle change to reduce the symptoms, or no? Mr. Natapan? كم قاعد يسمع. Oh,
Yes.
there you go.
Yes.
We're talking about lifestyle changes to hopefully reduce symptoms of phobias.
Yeah.
Would you say the thing that we talked about first thing, not looking at your phone first thing in the morning, would that be a lifestyle change or no?
Yes.
That
For sure. Anything that changes your routine throughout the day is a lifestyle change. Like active is a lifestyle. Sedentary
regular
is a
exercise.
lifestyle. Yeah.
Okay. So, yeah, basically anything to fix your mood, it's like to, for you to have a healthy way of bettering your mood and decrease the symptoms. This is considered a lifestyle change. Next slide. Exposure therapy. I think we've talked about this enough. Exposure therapy, it evolves gradually, increasing the length and time you're exposed to this phobia. Let's go back to the spider example. Maybe at first the doctor knows that your brain will not take in seeing a spider straight away. So at first he might make you read about spiders, and next up maybe he'll show you a picture of a spider, just increasing your exposure. Next up he might bring a spider, but like you see it from a distance. And then next up you'll touch the spider. Next up he'll put the spider on you. Just stage by stage exposure to hopefully overcome your fear. Another example is if you have agoraphobia, the fear of open spaces and open and public spaces. You might start by going outside your house for a short time, before gradually increasing the length of the time you spend outside and the distance you travel from your house. That's another example. Exposure therapy can be very effective of ways of enabling you to cope with your anxiety. This is, in my opinion, this is the best way. All right, next slide. Any questions? Oh, we're good. Okay. Other self-help techniques include relaxation techniques, a series of physical exercises that help you relax in controlling your breath, aka yoga. Visualization combines relaxation and breathing techniques with mental visualizing how you'll successfully deal with a situation that could cause anxiety. So you meditate, and basically, let's say you have a phobia of presenting in front of a lot of people. So just sit there and just imagine the scene of you doing it. If you could imagine the scene properly and predict what would happen, you might not be as afraid of what you would be, because you know what to expect. You know what's going to come up. This is similar to um, exposure, but instead of like actually exposing yourself to it and knowing what to expect through exposure, you know what to expect through visualization. Self-help groups, a useful way of meeting others with similar experiences and sharing ways of coping. Basically talking to other people. If you talk to other people, somebody might say, I have a fear of spiders, and then another person would say, I have a fear of heights. Knowing that you're not alone in this fear might decrease your fear, and how you discuss with them how they cope with their fear, and then apply it to your fear, and so on and so forth.
Thanks for your
That's
attention.
it.
Here is the end of the presentation.